Laser hair removal is a very common procedure done in the dermatologist's office. In the appropriate hands, it's actually very safe and works very well. The way lasers work are they target different chromophores. The way laser hair removal works is it targets the hair follicle. It usually requires between 4 to 8 treatments. And then again, if it's done in the proper fashion, it works very well. Unfortunately, a lot of people are doing laser hair removal out of salons, out of their homes, and that's when people get into problems. Customers or clients have to know, or patients have to know, that all lasers are not equal, and you should see someone like a dermatologist who has a medical grade laser. Another common procedure which is done in the office is called intense pulse light, or IPL. How IPL works is it targets different chromophores in the skin, so it addresses many issues at once. It will address irregular pigmentation such as brown spots as well as broken blood vessels. It is a series of treatments. We usually recommend 3 to 4 treatments in the office. In the right hands, it is very safe and works very well. Another common problem I see in the office, people are concerned about a thing called a cherry angioma. Cherry angiomas are those very small blood vessels. They can occur anywhere on the body. Patients just don't like the look of them. They can also be easily removed in the office using a few different techniques. I use a procedure called radiosurgery as well as different lasers to address this issue. Epidermoid cysts are another common problem. These are lesions or spots that are almost like lumps under the skin. Patients don't like the way they look. They can occur anywhere on the body. Again, these can be easily treated in the office with a procedure called an excision. The patient comes in, we cleanse the skin. We also use local anesthetic to numb the area, and then the cyst or whatever, actually the cyst is removed and closed with sutures. Another common problem that I see on a daily basis is the dreaded skin tag. Patients come in with these lesions which are commonly on the neck, the groin, or the eyelids. They're basically just growths of skin. They're very, very common. They can be removed easily. Again, I use a procedure called radiosurgery, which is basically using high-frequency radio waves to remove the lesion. It leaves a very small scar, if a scar at all. Patients are very happy having these removed. Another common concern, which is very frustrating and can be very embarrassing for patients, is a condition called hyperhidrosis, or excessive sweating. Another procedure which is done very frequently in the office is Botox injections. This has been life-changing for many patients because it does decrease sweating in the areas, commonly axilla or armpits, hands, and feet. So Botox can be done to actually decrease the sweating in these patients. Another common concern we see in the office is hyperhidrosis, or decreased growth of hair. Women especially are very concerned about their eyelashes, so there's a product called LATISSE which can be used to cause the eyelashes to grow thicker and longer. It's a liquid that's put on the eyelid margin, and it causes the eyelashes to grow thicker and longer.